My name is Kelly Lehr, and my viral presentation is on Lyme disease. Lyme disease is an illness that is caused by the Borrelia burgdorferi bacterium. Lyme disease causes different types of symptoms as the disease spreads throughout the body. Early symptoms of Lyme disease can mimic the flu. These symptoms usually start within 3 to 30 days after the person is infected. These symptoms include fever, chills, headache, fatigue, swollen lymph nodes, and muscle and joint aches. One of the most identifiable symptoms of Lyme disease is the erythema migrans rash. This rash can be found anywhere on the body, and as you can see in the picture, it looks like a bullseye. After 30 days, if the person doesn't seek treatment, or if they sought treatment too late, symptoms can become more serious. These symptoms would include severe headaches and neck stiffness, arthritis, severe joint pain and swelling, facial paralysis or Bell's palsy, Lyme carditis, which causes irregular heartbeat or heart palpitations, and nerve pain that can be debilitating. The arthritis and nerve pain can then last the person for the rest of their life. Treatment for Lyme disease is antibiotics. The main ones used are doxycycline, amoxicillin, or cefuroxime acetyl, and those can clear most cases. There are cases, however, where the patient's symptoms are more severe, or where they have neurological or cardiac issues, and that patient may need IV antibiotics, and those would be ceftriaxone or penicillin. Lyme disease is transmitted to humans by bites from black-legged ticks. In order to transmit the bacteria, the tick must be attached for 36 to 48 hours or more. You may be saying to yourself, how could a person not notice a tick on their body for that long? That's what I was thinking. Most of the bites that actually transmit Lyme disease come from nymphs, which are the young ticks. They're kind of like the larva stage of a tick. They're very small and hard to see, so they could be attached for longer periods of time before a person would notice them. And they also like to go in places where they're harder to find, like armpits or in your hair or in the groin area. Adult ticks can also spread Lyme disease, but more often than not, they are found on the body before the disease can be spread by them. Black-legged ticks are also the reservoir for Lyme disease. They are known as a vector, which means they are a live animal that transmits the disease to the host. The viral genome of Lyme disease is double-stranded DNA. And finally, for prevention, the best idea is to avoid areas where ticks are prominent. Of course, ticks can be found anywhere outside. Even if you don't have a tree in your yard, you can have a tick. So usually using bug repellent to deter the ticks is helpful. Also, if you're going to be walking or hiking in wooded areas, wearing long sleeves and jeans is helpful because then the ticks have a harder time getting onto your body. And then once you are home, check your body and personal items for any ticks. Wash all your clothes and dry them on high heat for 10 minutes to kill any ticks that might be on your clothing. And check all your personal items and your pets for ticks as well to make sure that they haven't carried anything in. For a list of references, most of mine came from the CDC website. They had a lot of information, of course, on Lyme disease. I also found some information in our textbook about the disease and how it is transmitted. And then there was a website that I used for finding out the viral genome. Thank you very much.